In some patients, it's advantageous to examine them in a recumbent position. Large patients, tense patients, or patients who are particularly anxious can be difficult in this standing location. Once you've palpated for the presence of atrophy, effusion, and generalized discomfort, it may be wise to take the patient into that recumbent position. To do that, you require your assistant to control the front, particularly the head, and from behind, you sweep the legs. So support and then sweep, coming down to the ground in a smooth and confident fashion. It's important to brace the back of the dog against your body so that they know where you are and they feel secure. In this case, Ricky is nervous, but he's not struggling. And we're able to then perform his orthopedic exam with more ease. It's particularly interesting when examining the knee, the effect of quadricep and hamstring contraction. And it is important in this position to understand that in the cases of dogs with patellar instability, they will often have more stability in a recumbent position because of the relaxation of some of the muscular components of that disorder. The same is found in sedated patients. Once in this position, hip extension, hip flexion, hip abduction can all be assessed with a rotational component as well. The stifle can be placed into full extension, full flexion. The thrust test can be performed with different degrees of both internal, neutral rotation, but also different degrees of flexion extension. The hock exam is also more readily performed in a recumbent position, particularly in terms of assessing lateral and medial instability. In this position, dogs are often less concerned about foot, toe palpation, and the pes can be examined more readily. The thoracic limb can also be palpated. It is sometimes helpful to move your body cranially to get better balance and to be able to control the limb more thoroughly. In this position, shoulder extension, shoulder flexion, bicep tendon test, adduction angles can be examined in an unsedated patient. The elbow can be flexed, extended, pronated and supinated, and pronated flexion, supinated flexion can be assessed. Long bones can be palpated thoroughly, and particularly the distal limb is at an advantage in this location. Medial instability of the radiocarpal joint, lateral instability, the presence of metacarpal pain, and digital manipulation can be readily performed with the patients in this location.